Performing caregiver tasks such as taking vital signs or giving a bed bath may seem rather simple compared to the development of therapeutic skills. Hi, I'm Kathy Getrist, and today we're going to be talking about therapeutic interactions. Therapeutic interactions means the helping relationship that you develop with your coworkers and the patients with whom you work. In a busy facility, it's often easy to forget that the individual in that bed has some very unique needs and is a unique individual. We cannot assume that everyone is like we are. Our ways of relating to others and behaving are determined by many factors. Some of those factors are the age of the person. Somebody at 20 might relate very differently than somebody at the age of 80. Religion also is a factor that varies depending on our belief system. If a person has a belief that God is in control of their life and that God has their best interest at heart, they may behave or relate to you in a different way than someone who might be an atheist who does not believe in God and finds most or all of their meaning in the quality of life right here on earth. Another factor is income level. If a person comes to you that does not have health insurance or is poor economically, it's going to be much more difficult for them, and their behavior may be different than someone who isn't worrying about those factors. Gender makes a difference in how we relate to others and how we behave as well. Men typically have more difficulty showing their emotions than women. Communication that men have is different than women, so the way they relate to others changes based on the gender. Culture is another factor. I'd like you to think back when you were growing up to what were some of your healthcare practices in the culture in which you came from. A couple of things that come to my mind is that my mother felt that chicken soup could solve just about anything, and that was the first line of defense when we became ill. My father believed that working hard was very important. He was a farmer, and if he got a fever, he thought working it off was really the way to resolve that problem. And he felt that going to a hospital or to a doctor was a sign of weakness, and the better thing to do was to tough it out. I'd like you to watch several people from different cultures describe their health practices from their experience.
My parents were born in China. Both of them immigrated to the United States as adults. And I was born in Milwaukee, so I was raised in this culture.
I am a second-generation Mexican-American. I was born and raised in Texas. My mother and father were both born and raised in Texas.
I grew up in an urban community, and as a child, my father used to take oranges, make fresh orange juice, and put castor oil in it, and he felt that was a cure for the common cold.
When I was growing up, I remember that whenever I had a stomach ache, my mother took out a little thin vial with little brown pellets in it, and she'd tell me to take 8 of them, and it always worked.
But I also remember a particular remedy that my mom used to, use on us, and that was the use of tomatoes that were mixed with some herbs that were then applied to the tonsil area around our neck.
My parents were raised in India, but we moved to America when I was a baby.
When my sister and I got measles, my mother made a salve. I remember part of it was sulfur and some other ingredients. It had an awful odor. She would spread it over our bodies, and then she would take socks and put a basting stitch around the neck of the sock and put it on each of our hands so that we couldn't scratch our bodies.
We believe in all the prophets, but the last prophet, we believe in Muhammad. He said the onion seed is the cure for every disease except for death. So we take a little, just a pinch of onion seed in the morning with our breakfast.
And I guess I still have my tonsils. That remedy worked. The remedy would go away. I mean, the pain or the ailment would go away. So, do I believe in those things? Yes, I do.
Sometimes when I have an upset stomach, I think I wish I had those little brown pellets to take.
I'm sure many of those health practices were unfamiliar to you. Just a reminder that we are not all alike, and we need to remember that each is an individual with unique needs and behaviors. We develop relationships with everyone we know. Some of those relationships are lasting and very rich, deep relationships, and others are more casual. Most of the satisfaction that a caregiver gets from their work comes from the quality of the interactions that they have with patients and staff. Some people call this the ability to get along with others. Good relationships with others begin within each one of us. It's not necessary for you to personally like somebody in order to be pleasant and cooperative with them as you carry out your duties. Perhaps the single most important characteristic that you bring to your job is your attitude. Some people talk about someone having an attitude, and the way they're using that is thinking about attitude as negative or opinionated, but all of us have an attitude, and this attitude can either be positive or it can be negative. All of the other characteristics are an outer reflection of our inner feelings, our attitude toward yourself and towards others. Your attitude should reflect warmth. That means showing a friendly, interested, and caring attitude without overwhelming the patients with a false sense of cheerfulness. Warmth means showing respect, genuine interest, and caring about them. Trust is another thing that needs to be shown. That must be present for help to be given and received. A therapeutic relationship is firmly rooted in trust. For trust to be developed, it must be consistent. Being consistently trustworthy is an expression of your personal integrity and builds the foundation for an effective relationship. There will be times that you will have an opportunity to develop trust or lack of trust with your patients. If a person asks you to get them some water and you say, "All right, Mrs. Jones, I'll do that and I'll be right back," and if you come right back with that water, that helps demonstrate trust because you followed through on your commitment. If a caregiver asks you to come by a patient room at 10 o'clock because they need some assistance in turning that individual, and you follow through and come by at the time designated, that demonstrates trust as well. Empathy is understanding another person's perception of a situation. The phrase, "walk a mile in my shoes," describes empathy really very well. Through empathy, we are able to see the world from the patient's perspective with as much understanding as possible. Empathy is not the same thing as sympathy. Sympathy is a feeling of pity for a patient's situation and